And it's just 4 fingers and 1 opposable thumb, but that 1 opposable thumb makes us do so much more than any other animal. It has 27 bones. So this little thing, 27 bones, but it makes it work so well. There's 20 muscles in the forearm, and they help us kind of make a fist and open up the fist. So all the strength that we get for our hands are coming from the forearm muscles. 20 separate muscles in the hand itself that make you do the finer work, buttoning buttons, writing down. Those are all the fine motor motion that we have with our hand. What arthritis is, it's actually a loss of cartilage. If you look at the x-ray, here you should see a good thick line of dark color, okay? When patients lose this, like this patient is losing this, that means that the cartilage, the cushion between the 2 ends of the bone is going away. So the arthritis is developing in this joint, okay? It's progressed to this joint where there's very little dark spot in there, not like this. This is normal, this is becoming abnormal, this is progressing to further stages, and then eventually it can become bone on bone rubbing and almost become a single finger infused. These are the arthritis of the fingertips is the most common arthritis we see in patients, and it's obviously worse with age. It can be very painful, in some patients it's not, so it just kind of depends on patient symptoms, whether we treat it with surgery or not. The thumb arthritis, here's a good picture of what arthritis looks like. This is what normal would be. Here's the end of the bone that you can see on x-ray, and then there's a cap of cartilage on each side. It provides good gliding surface, and especially for this thumb. This thumb has such a good function. This picture kind of depicts it here, how much it can rotate. So when the cartilage is worn off, arthritis develops, okay? So you lose the cartilage and you get that bone on bone rubbing and major inflammation. So for this, we like for the patients to wear a splint. It relaxes them, it prevents that rotational bone on bone rubbing, and we like them to wear it at night. They get 6 to 8 hours of good rest of that joint. They don't get it much worse. And also a similar thing, if there's significant inflammation and pain because of this, we can try to inject it with a steroid and kind of buy out some time and see how they progress. A lot of times they will have no progression of disease, and we don't have to do surgery. But if the surgery is necessary, this is what we do. So we remove the bone that's been diseased, and we put a nice cushion for this thumb to sit on, so you can still continue to rotate in all of its planes, but not cause pain from bone rubbing on bone. It's people who have repetitive motion. There's a space in our wrist that's covered with a tunnel. We have all these perfect spaces that things go through. We have a lot of tendons going through all of our fingers, okay, that make our fingers come down, as well as this nerve, the median nerve, goes right in between those tendons along with them. And it's really, really so much space in there. There isn't much more room for it. So people who sleep with their wrists down like this, they tuck in, I do it, or like this, totally open. In the morning they'll wake up and they will have numbness in their hand, okay? And they'll feel like they have to shake it off. They don't feel anything in their fingertips. There's sometimes a burning sensation. As the disease kind of progresses, the nerve gets more affected by it, becomes more permanent, and they feel weakness in their hand. They start dropping objects. So we try to avoid surgery once again. We try to be as conservative as we can be. So we will recommend splints. Nighttime patients, and only nighttime, patients will wear splints that put their wrist in a neutral position, just like this. So it's not too flexed and it's not too extended. So there's enough room. We just want a lot of room in that space for the nerve to breathe. But most of the time, the problem is that the tunnel is too tight. If the splints are not helping after 6 weeks, this is what we do. We make a tiny, about an inch long incision in the palm, and we open up that tunnel. We allow the patients to do anything they want. They get to move their hand right away. They have a little bit of dressing on for a few days. They take that off. They get to wash their hand, take showers. There's no problems with that. They don't get to lift. My patients don't get to lift for about a month because I don't want them to displace that nerve out of its position because they're taking some heavy objects and lifting them up. I don't want them to displace that nerve up towards the skin and make that area very sensitive. So that's the only thing that I do for my patients. They don't get to do anything, but otherwise they'll live their life and they're okay. And honestly, the day after surgery, they tell me they feel better most of the time. They have incisional pain, but there's no more numbness, tingling, everything comes back to normal pretty quickly. It's a remarkable surgery how effective it can be.